This is a demonstration of setting up a sterile field, donning sterile gloves, and performing a sterile wet-to-dry dressing change. The first part of the demonstration is going to be just setting up the sterile field. After I have gathered all of my equipment, come into my patient's room, I am going to wash my hands. And this demonstration I'm going to set up with a sterile barrier drape. Where I don't actually have a kit, I need to add all of the individual supplies. When you're using a sterile barrier drape, you want to lay it so that the opening is at the top of the table, and then you're going to gently pinch the very corners of the drape and open it towards you without shaking it, and making sure that you only touch 1 inch on any side of the drape. If the drape gets stuck, you can reach from the sides to straighten it out, making sure not to reach over your sterile field. You'll notice that I've pulled part of my drape off the table. I do not need the entire length of the bedside table for my drape. The next thing I'm going to open is my sterile bowl. Your sterile bowl should be placed at the edge of your field, closest to the patient. I'm going to open that and set that right. Next, I'm going to open my cling. Because cling does tend to bounce, I prefer to open it and drop it directly into my sterile bowl. Again, without reaching over the table. For the rest of my items, I want to open them very gently so they don't rip. And I will open them so that they are laying flat. And then I'm going to flip it into my field. If it lands within the 1-inch border, it is considered contaminated, in which case I would need to open another one. And I have brought extra supplies into the room in case something becomes contaminated. That would be contaminated, I couldn't use it. At this point, I have all of my supplies opened onto my field. The next thing I'm ready to do is to pour my solution into my sterile bowl after checking the date on my solution to make sure that it is not expired or that it has not been opened for more than 24 hours. I'm going to cover the label with the palm of my hand, and I now need to lip the bottle in order to create a sterile pathway for the fluid to run through. I do this by pouring off a little bit of the fluid, making sure that I do not drop the bottle below waist level. I'm going to just pour some off into the trash can, and then immediately from the same path that the fluid poured out of, I'm going to pour from the front or side edge of the table without reaching over my field, pour my solution into my bowl. I can come back recap it, and I'm going to set it off to the side. This is a demonstration of donning sterile gloves. Once I open my package of gloves, I want to fold back the folds on the gloves in order to allow the package to lay as flat as possible. Fold back the top and the bottom, and then I'm going to pull from the sides. I'm going to open it out, and I'm going to attempt to put a little crease in it again to allow it to lay flat. At this point, I'm going to don my dominant hand first. Please know that the gloves are laying so that your hands will go palms up with the thumbs inward. I'm going to pick up my dominant glove by the opening. I'm going to slide my dominant hand in. Once my dominant hand is gloved, my sterile gloved hand can only touch the fingers on the second glove. I cannot touch the inner cuff on the other glove. Sometimes these are stuck, the cuff is stuck to the gloves, and the way to get around that is with your gloved hand to hold on to the fingers. With your ungloved hand, put your hand inside the gloves and just pull. You now give yourself a bit of an opening to slide your forefingers underneath of the cuff. Hold your thumb out, abducted, so it is like in a hitchhiking position. And then I'm going to pull the glove onto my non-dominant hand. Once I have both gloves on, I can fix my fingers if I need be. If you notice my cuffs are rolled, I'm just going to leave them exactly as they are. And at this point, my hands are sterile. They are not to drop below my waist or they become non-sterile. In some facilities, you will have a dressing kit that is sterile wrapped, in which case you don't need to gather all of the individual supplies. You do, however, want to check the content label on the package and make sure that everything you need is in it. Next, you want to look at the package and make sure that the package integrity is intact, that there are no holes in it. When we open the kit, we're going to place it in the center of the table with the first opening going away from you. When you do that, you want to make sure that you do not reach over the kit itself, but actually have your hand off to the side. Next, you're going to open whichever end is available, whichever side is available to you. In this case, it's the right side, and then the left side. Then I'm going to open the side closest to me. I'm going to position my kit so that the area where the solution is going to go is closest to the wound. I can reach in from the front and pull out my sterile gloves, set them aside, and then I'm going to go ahead and pour my solution. At this point, I cannot touch anything inside that kit until I have my gloves on. The entire contents are considered sterile. once I have donned my gloves, I am free to go in and rearrange the contents of my kit. I like to set them up in the order in which I will be using them. I like to open up my 4x4s so they're all ready to go after the wound has been packed. My 2x2s are already in my solution. My Q-tip I can put in my solution also to get it wet, makes it easier to use. And now I'm ready to proceed with my dressing change. Now I'm going to demonstrate a sterile wet to dry dressing change from start to finish. After I have verified my patient's order and gathered my equipment, I'm ready to proceed. Good morning, my name is Mary. I'm going to be your nurse today. Can you tell me what your name is? Mr. Jones, I just need to check your bracelet to make sure that it agrees. Yes, it does. Your doctor has ordered a sterile dressing change on your abdominal wound today, so I'm going to do that. Are you having any pain at all? If 1 were no pain and 10 were the most pain you've ever had in your life, can you tell me what your number is? 1, you're not having any pain? Okay, that's fine. We'll go ahead and proceed then. I just need to pull your curtain. Mr. Jones, I'm just going to bring your bed up to a level that's good for me so I don't go home with a backache at the end of the day. And I'm going to pull your covers down just enough so that I can see your wound. I'll cover you up, keep you warm up top. That's just the trash can that I'm moving with my foot. First, I'm going to loosen up the tape a little bit, Mr. Jones, before I put the gloves on. Tape and gloves often do not go well together. Okay. All right, Mr. Jones, I'm just going to remove the dressing. The top dressing looks good, not too much drainage. All right, we got that packing out. That looks okay too. Okay, Mr. Jones, I'm just going to get everything ready here. It's just a little solution you hear. After I get my gloves on, Mr. Jones, the first thing I'm going to do is clean your wound 3 times. It will feel wet and hopefully not too cold. Okay, Mr. Jones, I just need to clean your wound. This may feel wet and hopefully not too cold. I need to do it 3 times. That's number 2. And the 3rd time. I'm getting ready to put the packing in your wound. You doing okay? Okay, Mr. Jones, I'm just going to pack your wound. We're almost done here. You're doing great. Okay, I just need to tape it. And I have one more piece of tape to put on Mr. Jones. I just need to label it so that the nurses behind me know when this dressing was changed. Okay, let me just clean up my mess here. Alrighty, pull your gown back down, get you all situated again. Are you comfortable? Is there anything that I can get for you? No? Okay, great. At this point, when I leave the room, I would go and document. It's important to document the size of the wound, the granulation, tissue, signs of healing, any drainage that was present, noting the color, the consistency, any odor of it, and the date and the time that the dressing was changed.